It's flattering to be recognized, working collaboratively. I think that's the most meaningful part about it, that's recognized as being important and valued. So on a personal level, it makes me feel like I'm at home in a sense that I'm with my people. I'm Brian Chesebro. I'm a practicing anesthesiologist in Portland, Oregon. And I also work as the medical director for environmental stewardship for the Providence health system in the Western United States. What it felt like when I realized the environmental impact of anesthesia. It was life-changing to understand that my biggest opportunity, my biggest impact on the environment was through my practice as an individual anesthesiologist, and then more broadly than that, as a director of quality for my private practice group, or as a medical director for anesthesia within the Providence health system at the time. Up to that point, I was working on clinical quality projects and looking at efficiency outcomes in the operating room. But around 2016, got really disillusioned with the state of the environment and prompted a whole life reevaluation of myself and my family to figure out instead of being paralyzed by despair, what's the best action that I can take at this point? And I didn't know what it was going to be. I didn't anticipate that it would be through my clinical work as an anesthesiologist. But once I saw that that was by far my biggest opportunity, I just started running toward it as fast as I could. My priority to make sure that my work is not proprietary for Providence. When talking about environmental impact and climate change in particular, it's a global problem that's influenced and felt by everybody. And to me, it doesn't make sense to hold advancements within any organization. It doesn't do me or my family any good, or healthcare as an industry any good, if Providence or Kaiser or Legacy hold their innovations as being proprietary. We all need to change, and we'll move a lot faster if people change together. Helping other people helps them identify opportunities and barriers in their system. Selfishly working with them, I feel like I learn more from them than they do from me many times. And I think that collaboration across multiple institutions, working with lots of people who are a lot smarter than I am, helps everything move much, much faster. It's a collaborative effort for the common good. I would encourage new people who are at CleanMed for the first time or interested in entering into this space to jump in. I think it's an exciting time to be working in healthcare sustainability, because there's a lot that we know and understand. There's a lot more that we don't know. And we need people from every facet of healthcare to put their minds and their hearts into figuring out the next best practice and figure out the best way to implement that best practice. And just because you're new and you feel like you're drinking from a fire hose, just like I felt 10 years ago, don't let that stop you from elbowing in and learning. There's so much to learn, and there's a community here that's eager to help you. So again, that collaborative community, I think, will help everyone move faster, which is the ultimate goal. For people who are getting started, credibility is everything. Most of us don't hold roles that are authoritative, in which we can tell people what to do or unilaterally make change. We work through influence and crafting a stronger argument that can move a system to change. And recognizing the complexity of the healthcare system in that context, building credibility requires that you take a perspective that's broader than just looking at environmental impact. You have to look at the other facets of quality and cost and value to make sure that whatever change you're advocating is to the benefit of the overall health system and the patients that we serve. Building credibility with that kind of perspective requires having better data than anybody else, understanding the system better than anybody else. Even though your priority might be environmental cost reduction, you have to understand finance. You have to understand patient safety, efficiency of systems, resilience. You have to understand regulatory compliance issues, patient-centeredness, equity. All those things matter, and they all need to be brought together when considering whether or not to make a change. And if you adopt that perspective, when you meet with other teams and leaders and you present this cohesive approach to change and an argument for change, your credibility just starts going up, because they trust you. They trust you to be looking from multiple perspectives, to hold multiple priorities in your hand at the same time, is how you build credibility. in my opinion. I hope in 10 years we'll have an even larger army of advocates across the entire spectrum of healthcare, because that's what we need. We don't just need clinicians. We don't just need facilities engineers. We need people. We need dietitians and pharmacists and nurses and doctors and C-suite leaders. We need all of those people working within their spheres of influence to create this overarching sphere that moves the whole industry. There's so much unknown still. We understand that the problem is big, and at this point we're still trying to get our arms around it in many ways, and to understand, how do I hold this giant apple before I try to take a bite out of it? And I think in 10 years I hope that we're all happily eating apples. In 10 years I hope that we have a much better sense of the concrete opportunities that are in front of us, and that we have industry partners that are ready and willing to help us implement the change that we want to see. Right now, that's a barrier that everyone's working hard on both sides to try and meet in the middle. Hopefully in 10 years, it's not just the health systems. It's not motivated industry. It's not insurance companies. It's the entire healthcare system has to be working together to make this happen. Working collaboratively and working with generosity, I just can't see any other way to do it, honestly. And it goes along with not wanting the work to be proprietary. It's not my work. It's all of our work. It doesn't do any of us any good to stand in our silos and plug away. We have to reach across and help each other. It's flattering to be recognized, less so as an individual than some of the comments that have been made about working with generosity and working collaboratively. I think that's the most meaningful part about it, that's recognized as being important and valued within Healthcare Without Harm and this community, that's a value of theirs when it's so intensely a core value of mine. So on a personal level, it makes me feel like I'm at home in a sense that I'm with my people, to know that approach to the work is seen as important and worthy of an award.